Hello to everyone at the inaugural seminar at the NIH's new National Smell and Taste Center. Thank you to all the researchers, clinicians, and advocates gathered today for all you do to advance our understanding of the chemical senses. Anyone who went to a 4th of July barbecue last week knows that our senses of taste and smell make our lives better. Think about the smell of burgers on the grill. Okay, I'm right now. First bite of corn on the cob, big deal in Minnesota. The taste of your favorite ice cream on a hot summer day, cookies and cream. We take these moments for granted, which is why when someone loses their sense of taste or smell, it can be overwhelming. We saw this during the pandemic, when more than 60% of COVID patients reported losing at least one of these senses, but we know that this issue is much broader than COVID. 25% of multiple sclerosis patients experience a diminished sense of taste. Between 75 and 90% of Parkinson's patients experience a loss of smell, and the same is true for up to 90% of Alzheimer's patients. But we know that this isn't just about those numbers. It's about our moms and dads, our grandmas and grandpas, friends and neighbors. That's why you're all gathered today. Just by showing up at today's seminar, you're all doing your part to begin that incredible work and the rejuvenation of the work that we're doing on taste and smell research. Now we must do our part. That's why I'm focused on increasing federal funding for basic medical research. This year marked the 10th year in a row that I work with my colleagues to increase NIH funding, because whether it's searching for a cure for cancer, improving the way we treat mental illnesses, or carrying out cutting-edge taste and smell research, everything this agency does brings our country closer to a healthier future. I'll keep fighting for this funding because every federal dollar we invest in research today paves the way for treatments and cures of tomorrow. And working together, clinicians and advocates, I know we can build a more complete understanding of the chemical senses. And I'll end with this. If you visit my office, you'll see a picture hanging on the wall. It's a drawing of a woman. She's holding the earth in her hands, and it's being handed to her by an angel. And the words read, "In my dream, the angel shrugged and said, if we fail this time, it will be a failure of imagination." And then she placed the world gently in the palm of my hand. Well, the future of research on the chemical senses is in the palms of our hands, of your hands. And when it comes to the dedication, the ideas, and the passion of everyone gathered today, I know we aren't going to fail, because there is no lack of talent or ambition in this room. And I know that you have the imagination we so dearly need right now in our world. So let's get going on this groundbreaking research. We all can't wait to see the work that comes out of it. Thanks, and it's been an honor to just spend a few moments with you, even if it is via video. Thanks, everyone.
Hi, everyone. I'm Maryland Congressman David Trone. Today, I'd like to celebrate the creation of the National Smell and Taste Center at NIH, an important step forward in advancing this research. It's through this research that we develop groundbreaking treatments and improve the quality of life for countless individuals. I want to commend the efforts of the scientists, clinicians, researchers who make this work possible. Your dedication is truly making a difference, and I'm excited to see the impactful discoveries that will emerge from this important center. Thank you, and take care.
Hi, I'm Chris Van Hollen, and I'm proud to represent Maryland in the United States Senate. And I'm especially pleased to join all of you to commemorate the opening of the new National Smell and Taste Center at the National Institutes of Health. And I'd like to acknowledge Dr. Deborah Tusi, Director of the National Institute on Deafness and Other Communication Disorders, for your good work and for inviting me to offer a few words at today's inaugural seminar. The consequences of losing one's sense of smell and taste may appear subtle, but could be life-threatening. They include missing signs of danger, like gas leaks and spoiled food, or experiencing weight loss and malnutrition, or losing some aspects of simple joys, like sharing a good meal with loved ones. Scientists believe that up to 15% of adults experience a taste or smell deficit, but many do not seek a doctor's help. The COVID-19 pandemic has afflicted millions more, and those who do seek medical attention discover that unfortunately, the treatments we currently offer are extremely limited. We can and must do better. The new National Smell and Taste Center promises to transform NIH's work in this area. Through research and treatment and outreach, you will improve the lives of millions of Americans and help people around the world. I'm proud to represent thousands of NIH employees who live and work in Maryland and to be your partner in Congress. As a member of the Senate Appropriations Committee, I'm committed to securing the funds necessary for you to do your work and succeed. In the final 2024 fiscal year budget, my colleagues and I included $47.8 billion, which was a $943 million increase above fiscal year 23 to support NIH's critical work. Not only do your indispensable efforts help millions of Americans, they are a shining example of American leadership around the world. Today, as you exchange ideas and build relationships at the seminar, you have the chance to further advance this mission. So let me end in the spirit that I began, by saluting you as you launch this new center and thanking you for all you do. Take care.
Hi, everyone. I'm Congresswoman Bonnie Watson Coleman, and I represent New Jersey's 12th District. I want to congratulate the National Institute of Health on the opening of the National Smell and Taste Center, which will advance our understanding of the chemical senses and the disorders that affect them. And as an advocate for ongoing research into the effects of long COVID, I am eager to see the results of the important work that the center will conduct in the coming months and years. By devoting resources to this important research, we can not only advance our understanding of diseases and disorders that rob people of their senses, but ensure that treatments and remedies are available on an equitable basis. For people who suffer from illnesses that affect the chemical senses, the consequences are far-reaching with implications for overall nutrition, health, and quality of life. We have a responsibility to those who suffer from these conditions to do everything we can to support them with new and innovative treatments. Thank you all who are gathered here today and to those who will conduct the important research into treating sensory dysfunction. May God bless you and the work that you do.